trouble standing up from a chair? If you do, then it's likely you might have a bit of arthritis in the knees or the hips or back pain or muscle pain in the legs. And what you'll tend to do is you'll use your arms to lever yourself up. Now, the only problem with doing it that way is you're going to make your muscles in the thigh, which straighten the knees, and your buttocks, which straighten the hips, weaker. And if they become weaker, it gets more difficult to stand up again. If that's the case, then I'm going to show you some simple exercises that will help your sit to stand within a couple of weeks at least. If you're really struggling with standing up and sitting down, it might be easier to start with this exercise. Feet about hip width apart, chair in front of you, and what you're going to do is mimic sitting down. So you're going to squeeze your buttocks a little bit and go to sit and then stand up. Might be easier to have a chair behind you just in case something catches in your knee if you get giving way in knees or hips. Then if you fall backwards you've got something to sit on. Just squeeze to sit and stand. And if that is too difficult, you might even have to break it down and just do a small movement. And you start off doing slowly about 10 of those if you can manage that, 5 if you can't, and build up. You can do this exercise every time the kettle's boiling, if you drink as much tea and coffee as I do, and then through the day you'll have done it many times. Because if you think about it, you're up and down out of a chair anyway, lots of times, so it's not a lot of different to what you should be able to do. So just to repeat, feet hip distance apart, holding onto the chair, maybe another dining chair behind you, little squeeze of the buttocks and go to sit down and then come back up. At least 5 times, aiming for 10 or more. You've performed the exercise holding on the back of the chair doing the squats. That's become easy. So you're ready now to start to do the actual sit to stand. I've got a dining room chair and I've put a couple of cushions on it to make it higher, to make it easier. Now, what I'm going to do, I'm going to have my feet slightly more than hip distance apart and tucked backwards. I'm going to bring myself towards the edge of the chair. Now when I put my hands across my shoulders out the way and lean forwards, my weight is over my feet. I'm going to squeeze my buttocks as I go forwards and use that to lift myself up. And the same thing sitting down, squeeze the buttocks as I go down to control it and gently sit back on the cushions. Squeeze as you lean forwards and use that to stand yourself up. Squeezing again on the way down. You should be able to manage at least 5 of those, aiming for 10 minimum, but you can do more. Again, every time you boil the kettle, practice this. Now, if that's still too difficult, try the next one. This time I'm in the dining room itself. I have the table in front of me. I'm still sat on the dining room chair with 2 cushions. I'm coming to the edge as before, feet apart. This time I'm going to put my hands on the table. What I don't want to do is push down hard. So you can use your fingertips just to support, or you can put your hands flat. So I'll do both ways. So at the edge of the table, coming forward, squeezing my buttocks and coming up. And I'm using minimal weight. I'm more using my hands to support myself, just so I feel secure, rather than pushing into it. Fingertips this time, squeeze and push up. And then sit down. And again. Same principle as before. You do at least 5 to 10 and do it every time the kettle boils, and that way you'll get plenty of practice through the day if you drink tea or coffee. At least 3 times a day, but you get up and down from a chair more frequently than that, so it's better to do more often in the day, especially in the first few weeks. Something else happens when you stand up and sit down. that's very important to be able to do that, as well as the muscles of your thigh and buttocks working to lift you up. You need a certain amount of movement around the pelvis. So when you sit, you tend to be slouched. So when you come to the edge of the chair, you sit up straight. As you stand up, your bottom should stick outwards. That's an exaggeration. And then as you stand up, it tucks in. To sit down, the same thing happens. You stick your bottom out to sit down. Having this flexibility around your back is very important. And that's another reason why people have difficulty standing up and sitting down. If that's the case, it might be helpful just to sit on the edge of the chair and get that movement loosened off around your pelvis. Keep within the confines of your pain. If it's too painful going in one direction or the other, then just start it gently and build up gradually. As you stand and sit, it should get easier. Who thought sitting could be so complicated?